Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of ENT is sinusitis. We will discuss our topic of sinusitis in 4 sections. In the first section, we will talk about the etiology of sinusitis and then pathology of sinusitis. And besides etiology and pathology, we will also talk about the bacteriology, or what are the different bacteria that can cause sinusitis. Then in the second section, we will talk about the acute sinusitis. Acute is the short duration, short term. So sinusitis that is short term in onset. We will talk about the acute maxillary and frontal sinusitis, acute ethmoid sinusitis, and acute sphenoid sinusitis. These are 4 paranasal sinuses. So when there is acute infection of these 4 sinuses, how they present and how we can diagnose and treat, we will discuss this in second section. Then in the third section, we will talk about chronic sinusitis. What's the pathology of chronic sinusitis, how it develops and how the disease process occur and affect the individual. What's the clinical features and diagnosis of chronic sinusitis and how we can manage it, usually by the surgery of chronic sinusitis. Then in the fourth and final section, we will talk about complications of sinusitis. Complications are more commonly associated with chronic sinusitis when it persists for longer duration of time. So we will talk about the complications that affects the local area and also the orbit or eyes. Then we will talk about the intracranial complications which can occur as a result of sinusitis, and also some descending and focal infections. Ascending is going up, so descending infections which travels from the top to the lower portion. So we will talk about those infections in this 4th section also. So all these topics will be covered in our today's lecture, sinusitis. So keep watching sqadia.com to learn more about this lecture.